Okay, I want to say welcome. Welcome to everyone to our presentation on community resources. I am John Young, your facilitator with the Center for African American Health. Let's start with some technical housekeeping. Feel free to use the question and answer feature at the bottom of the page or the chat feature to ask questions of the presenter. Please keep your questions focused to the theme of the moment to help with time. There will be time at the end to answer general questions. Specific questions, you can answer them as we go along. I want to say thanks to Chris, our technical support team. And our presenter today is with Denver Department of Public Health and Environment. She is excited to share. She is going to share relevant information, information that's interesting, and information that may be a little bit unusual. Join me in welcoming our presenter, Wendy Smittick.
Thank you, John, and thank you, Chris. I'm Wendy Smittick, and welcome to Community Resources. I'm going to share my slide with you. Hold on one second. Okay, so we are here to talk about resources that are available in the community. Okay, so I'm Wendy Smittick, and I presently work for Denver Department of Public Health and Environment. And I specifically work in food and communities, where I look at providing food through policies and through procedures to bring affordable, accessible, and culturally relevant foods to the neighborhoods. Before that, I was the program manager at Eastside Unified UNIDO, where I looked at 80205, and we were working together to level the playing field in that gentrified neighborhood. I also do patient navigator training for Anschutz Medical Center, where I train people on how to help people, patients who are in need of resources and to overcome barriers. And before that, I worked at the Center for African American Health as the Senior Wellness Program Manager. So that's how I have come to compile all the resources that I'm sharing with you today. So let's get started. So the reason that I have all of these resources is because I am passionate about health disparities when it comes to the African American community. Some of those health disparities are brought about by income inequalities and racial inequities. And so when I look at resources, I'm always trying to bring to bear the resources that will help people with the income inequalities and ultimately with the health disparities. So what we're going to talk about today is community resources with regards to dental and medical. We'll talk about sliding scale and discounted rates. We'll talk about food. We'll talk about finances. I also have some resources with regards to housing and utilities, whether that's mortgage or rental insurance, but I also have something with regards to homelessness. We'll also discuss mental health. And finally, I have some interesting ones that I just categorized as miscellaneous. So if we're looking for dental resources, there are several great resources in Colorado that are low fee or sliding scales. And below, I've listed some. When we're done, I have a link that will attach to every resource that I'm going to talk about here specifically. But overall, I have 45 plus resources that are available to you. And we'll put that link in at the end. So like I said, several different dental places where you can get low fee or even free dental care. And the first one that I want to look at is Colorado Mission of Mercy. There are several great resources in Colorado for low fee dental care. And there are several dental clinics and health centers throughout the state. Most of these organizations offer dental care on a sliding fee scale based on your financial situation. It's best to contact each individual clinic to see what the specific requirements are, but included in that list is University of Colorado School of Dental Medicine Community College of Denver, Denver Health Clinic at Eastside and Montbello, although it's all Denver Health, and also Inner City Health Center. So those all offer low-fee dental care. Moving along next, we'll talk about medical. And there are several, once again, great resources in Colorado. Oh, I'm sorry, it talks about dental care, but I want to talk about the medical. So you might be used to 9 Healthcare having health fair in April. This year it's remote, but what they've provided is you can get your cholesterol levels, checking for your kidney and your liver health with 28 different levels, and that will cost you $39. If you want your hemoglobin A1C, checking for diabetes, you can get that done as well. And that's $35. And once again, that link will be included in the document we give you. Second, I want to talk about Children's Hospital. They have a financial assistance program that's available to all patients who don't have health care and live in the United States. They expect that families will be able to use other resources first, but after that, they can assist you with financial aid. Qualifications for many of their assistance programs require that the patients meet the federal poverty income guidelines, and eligibility depends on family size, income, and age of the patient. So once again, you'll have a link for that. With regards to women's health, I listed a few here: Women's Wellness Connection, Wise Women Clinics, and the Wise Woman Clinics, they include free PAPs, free pelvic exams, free mammograms, and cardiovascular tests. So breast and cervical cancer screenings and heart screenings save lives. We never want anyone to not undergo screening for lack of finances. So women's health, we got you. Then I also included a sliding scale of many medical services. One is the Needy Meds. It includes meds, but it also includes medical services. And on that site, there are 273 free, low-cost, or sliding scale clinics in Colorado. And those actually include the Stride Clinics and Eastside Medical that you might be familiar with. And then medical equipment. There is an organization called Friends of Man. They work through referring professionals like caseworkers and case managers and healthcare workers. And they are on behalf of the patients and clients who need mobility equipment, prosthetics, glasses, dentures, hearing aids. So yeah, if you are in need of medical equipment, we have that. And then finally, with regards to medical, I included GoodRx. And GoodRx is a prescription company on the internet where you just go on, you tell them what medication you need, they give you the price at the different stores, you print out the coupon and take it in. It doesn't cost you anything to join. So that's GoodRx. All right. So let's talk about food. And food is, like I said, the specific category that I work on with regards to Denver Department of Health and Environment. I'm in food and communities. The first one I'd like to talk about, though, is SNAP benefits. And I do have the link for SNAP, and that is based on income, family size. But if in the past, before COVID, you qualified for the very least amount of SNAP, which was $16, now that COVID has taken place, that is now increased to over $100 a month. So the bare minimum that you're going to get from SNAP is over $100 a month. So that's SNAP, but we have many, many food pantries in the Denver area. So Metro Caring is the first one that I talk about, and they distribute between 4,000 and 6,500 pounds of food, baby items, and personal care products, and 500 people a day. Now, because of COVID, it used to be you could go in and shop. You can't shop in the grocery store style now. But what you do is you call them, you tell them what kind of box you need. They have it divided into just a regular box of food, but you can also ask for halal, vegetarian, heart healthy, diabetic, and they will specialize the box just for you. So that's Metro Caring. The next one is Village Exchange Center. They know that food insecurity is a critical issue within our community, even before COVID, but especially now. So they help families with children ages 6 to 18, and you can get free meal delivered. And finally, the big boy, Food Bank of the Rockies. They provide food and necessities to people in need through multiple programs throughout the city. So the link that I've shared with you with regards to Food Bank of the Rockies will take you to their website, and it's on that website that you can put in your address, and they will show you all the food pantries that are near your address. So that's the big boy, Food Bank of the Rockies. Next, financial resources. So there is one called Colorado's Old Age Pension Program, and that is for 60-year-olds and over. They provide financial assistance to elderly, low-income Colorado residents, and it's to help them attain a minimum monthly income. It doesn't supply a consistent lump sum every month. That just depends on how much they have, but they're just trying to bring seniors' income up to a minimum. So that's cash assistance for 60-plus-year-olds. Also, Catholic charities. Many of the Denver, Colorado Catholic charity programs are offered as part of the St. Veronica Outreach Ministry. They offer financial services, social services. They'll help with utilities and rent. And so I added a link for them, but also they will also help with taxes. So that's why I've included taxes on here, because Catholic Charities helps with that too, to help you get your taxes prepared. But I also wanted to point out, with regards to taxes, the earned income credit. So that is a federal tax discount credit. And what you need is a social security number to be between the ages of 25 and 65. And you need to make less than $57,000 a year. And that's just a ballpark, because of course it depends on your family size. But in Colorado, the average credit is $2,200 for an individual. And for a family, it's $3,200. And on top of all of that, Colorado then matches it 10%, whatever the credit is. So that's finances and credit. Next, I want to talk about housing and utilities. Because of COVID-19, there is a CDC eviction moratorium that's currently in effect. Now, that is not to say that someone cannot evict you, but you can use legal means to fight an eviction. So I do have links in the document that will take you to that information. But with regards to mortgage, and with the moratorium, I'm sorry, that ends on March 31st, 2021, unless there's a new stimulus package that's been passed, and we're hoping so on that one. The next one, though, with regards to mortgage and rental assistance, is Brothers Redevelopment. So if you're a resident of Denver County who's seeking rental assistance through the City of Denver's Temporary Rental and Utility Assistance Program, or TRUA, I've given a number where you could speak to a housing navigator, and they will determine your eligibility and start the process. Aurora, the City of Aurora, knows that the crisis from COVID-19 has really struck renters. And so they are using COVID-related federal funding to help people stay in their homes. So you'll see that link also in the document. And finally, homeless. There is a program called Aurora Warms the Night. They issue motel vouchers that are given out nightly through their different partnering agencies. So when you go to the link and you pull it up, it will tell you the number to call or the agencies that hand those out. And with regards to utilities, I didn't know until 20 minutes ago that actually the Center for African American Health is helping with utilities. So that's an organization you can call in addition to LEAP. So those are utility assistance programs. And finally, Miscellaneous, the big one, Mile High United Way 211. That is every resource that you could possibly imagine that you would need in Colorado. You can go on that website and they'll give you a number to call, or you could just look it up right there. It will tell you places where you can go get COVID tested and what the qualifications are, the vaccines, food, shelter, clothing, telephone service. Mile High 211 has a plethora of resources. So that's one that I have listed. Also, the government has a free cell phone service. I left the link for that. Lyft, the car Lyft program, they actually offer free rides if you want to go get a vaccine. So I've included all of those things in the 45 plus resources that I have in the document. So in conclusion, the reason that I come up with all these resources and I'm constantly collecting resources is because we are at a disadvantage in the African American community when it comes to the income gap. So we need every resource available. And even if you don't need it personally, hopefully you can pass it on to people that you know. Right before I came on, there was someone who hit me up and was looking for homelessness resources. So even if you don't need it, I hope that you'll download the document and you'll share it with others. But also, if you know of resources in the categories that I discussed, I'm going to leave you my email. Please feel free to drop me an email. I will resource it. I will check the link and make sure, and I will send it out. Also, if there's anything that I haven't covered in the document, please feel free to drop me an email.
Thank you, Wendy.
You're welcome. That's
I was just
okay.
going to invite people, if they had any questions, now would be a good time to ask, or they had some resources that they thought were really, really good. Maybe they might be willing to share those with the rest of us.
Please do. So this is what the document looks like. Everything that I talked about, I highlighted in a peach color. So if you want to quickly refer to something that I talked about, that's an easy find. And then everything else is in white. So I'm going to allow for questions and answers. I'm going to stop sharing and I will drop the link in the chat box. Thank you.
So what questions do we have? I think I have one. All the services, were there any other than maybe some of the medical services that had sliding scales?
Absolutely. I have probably about 5 or 6 that are listed. And within the 5 or 6, some of them you click and you just put your address in and it will show you all of the clinics that are near you that do sliding scale, including Stride. I think there's maybe 5 Strides in the Denver area. So those are all sliding scale.
Okay.
Okay. Let me get this link. Any other questions or comments? Well, okay. Let me get the link. I'm trying to find it. Anything in the chat?
Tracy says, thanks for a comprehensive information. She appreciates it.
You're welcome.
And I think I have a question too.
Yes.
Sharon says, good job. Thank you.
Thank you.
She's interested in getting the link. Also,
I'm trying to get it right now. I'm having difficulty, but yes, go ahead. I'm listening.
Oh, no, I was going to say, yeah, and these documents are always living and growing and changing and morphing and, you know, having babies and everything else. So what we see today in 5 to 6 months may be totally different.
And we hope so, right? Because they
Right.
continue to evolve and hopefully we're adding, right?
Right.
And I think just COVID in general lends itself to things constantly changing.
Carl asked, are there any resources for outside Denver and the rural Colorado?
So with regards to rural, I try to go with really Denver and Aurora. However, if you see a link and it's something you're interested in, I would call that particular office and then ask for the town that you're specifically interested in. Okay, get link. And here we go. Success. There we go. Oh, thank you for that other supply, medical supply source, Dominican Sisters. I am going to look that up. If you have a link, could you drop it? If not, I will research it. Sisters, Dominican Sisters, wonderful. Okay.
Thanks, Barbara.
Indeed. Well, so since we have a few more minutes, what I can do is just kind of give you a highlight of some other things that are in the document. How about that? And then, John, if you'll just watch and see if any questions come up. So I want to talk some more about some of the miscellaneous things. One is Colorado Peak. And they have food, cash, medical service, childcare assistance, and the RTD Live, which gets you 40% off of writing RTD. I have one that I thought was very interesting. It's called Safe to Tell. And it is an anonymous place where you can report concerns or threats to children. So whether that's a home that you think the child is in danger, or also for children who are in school who might think that they've heard something that might be dangerous that's going on at school. So I've got that listed. I actually have burial services. There is help to bury people. I've got a community kitchen in Aurora. I've got discounted phone and internet services. I've got legal services. Let's see, transportation. So Goodwill, the Goodwill, Goodwill, they have a program called Good Wheels, WHEELS, Good Wheels. And they pick up seniors and take them to their medical appointments. So that's Good Wheels. And I have that listed also. There's actually a property tax relief organization. Because of COVID, some people are unable to pay their property taxes. So there's assistance there. There's something that's called the Technology Loaner Program, and it's with the Denver Workforce Services. So you can borrow computers, hotspots, and cell phones. So that's with the Denver Workforce Services. Also, there's one that's free cell phone service, and that's with Q-Link. So you bring your phone, and then they give you the services for free, which is free data, free text, free calls. So yeah, lots of stuff available. Let's see, we talked about utilities. There's something called non-emergent medical transportation. So as long as it's not an emergency, there's an organization that you could call that they will come and pick you up and take you to medical appointments.
Wendy?
Yes.
Carl says there is an organization called Range of Motion Project. They supply prosthesis and care for amputees who don't have access to healthcare.
I love it. Thank you so much. I will research that. And like I said, I continue to grow this document and share it just to help people in our community. Can you put in the chat anything that I talked about that you found of special importance to you specifically? Because I'd like to know the areas that I need to add more information to.
Tracy says, great, thanks. And we have roughly about 6 minutes.
Okay. Okay. Yeah, anything that you found particularly interesting that you would like more resources on, I can add it to this document. Just let me know the category. If it's medical, dental, transportation, financial. Food especially. Okay, food assistance. Okay, great, thank you. Rent and utilities. Let's see if I can copy this chat.
And I want to remind people that we are also looking for them to give us some kind of feedback as to whether or not they found any of this or all this helpful, and if they have any suggestions or maybe ideas.
Absolutely, I would love that. Thank you. Thank you, thank you.
And Paula says this was very insightful session. Thank you.
You're welcome. I want to speak to dental also. Sometimes we think dental is only cosmetic. However, if you have problems with your gums, that can lead to, that's a problem even with regards to your cardiac health. There is a relationship between your dental health and your cardiac health. So just know that it's more than cosmetic when it comes to dental. So any actual healthcare service resources. I do know that Center for African American Health is they have access to the Obamacare, the Affordable Care Act, insurance. Are you asking me about insurance? Or are you asking me specifically about healthcare? I'm just curious. Actual healthcare. So with the medical health cares that I listed, including Stride and some of the Denver Health clinics, they have reduced fees based on your income. So that would cover any healthcare that you would need in the hospital or any of the clinics that they have. And I think the one that I listed had over 273 clinics across Colorado that offer that.
And if I might add, there's also inner city healthcare, which is
Yes.
at 3800 York in Denver.
And inner city health not only offers medical, but also dental. Also that Needy Meds, they're the ones that have 273 clinics that have either low cost or sliding scale clinics in Colorado. So that's the one that includes Stride, which I think there's about 5 in the city, but it also includes Eastside Medical Center, which is in 5 Points. Oh, I love that, Swing by Street. So is that medical supplies, Barbara? Is that medical supplies?
I don't know if she's still with us.
Okay, all right. Well, I am going to go ahead and close out now. Thank you so much. And please feel free. I said I would add my email, and I'll do that now. It's Wendy Smittick at denvergov.org. So drop me a line if you need further information, especially with regards to food, because that's the area that I'm working in now. But drop me an email. Let's conversate. Let's talk about resources. Thank you, and thank you for joining. I appreciate you.
Thank you, Wendy.
Thank you, John. And thank you, Chris.
You're very welcome. Have a good night.
Drive carefully.